Texas health officials are rolling out a new system at the beginning of the new year for more accurate birth and death records.
As KXAN's Steffi Lee explains, doctors are hopeful it will help better inform the decisions that they make about your health.
Something we've really come to understand a little bit more over the last few years is that in Texas, as in the United States, there's an issue with the quality of death data.
Texas health officials experienced this issue in April of this year. That's when the state learned the number of women who died while pregnant or after giving birth in 2012 was less than half of what old data suggested. 56 compared to the originally reported number of 147.
It's very important to get accurate information.
Dr. Phil Huang is with the Austin Public Health Department.
We really use it just so much in terms of identifying what are the problems, what sort of things do we need to do to try to address that, and then monitoring and seeing, are we making a difference?
You think about things like maternal mortality, drug-related deaths, deaths from chronic disease, heart disease, diabetes, those kinds of things. And the better the data we have, the better we're able to, design a strategy to counteract those things.
The new Texas Electronic Vital Events Registrar, or TexEver system, will have more checks in place.
It's essentially going to stop and say, okay, are you sure you've selected that this woman was pregnant when she died? Is that correct? And just another backstop like that hopefully is going to improve the quality of the death records.
Dr. Huang hopes down the road, accurate information can lead to getting information sooner.
And that will really be useful for everyone.
Steffi Lee, KXAN News.
The Texas Department of State Health Services will hold online and in-person training with people involved in the death reporting process. That includes justices of the peace, doctors, and medical examiners. The department will also continue to hold focus groups to learn about what gaps and challenges people are experiencing in recording and reporting births and deaths.